Hey, now it's my turn. Give me remote.
No, I can't give, sorry.
Give me.
Sorry, I can't give.
Give me. I said give me.
Before starting the procedure, wear mask and gloves and check your surrounding. You need to make sure the area is safe. Then call for the emergency services and inform.
Hello, I'm Dr. Shireen. Hello, can you hear me? What's your name? Hello, can you open your eyes? So there is no response from the patient. I'm going to check his breath, air breath. So patient is breathing. So the patient is breathing 24 breaths per minute and there is no obstruction. Now I'm going to check the patient's Keratic Pulse. So the pulse is 110 and the patient is in hypotensive state. Check the patient have breathing. So the patient have wound in the right arm. Now I'm going to do first aid by applying bandage in the right arm. Now I'm going to check the neurological signs while checking the eyes. Can you open your eyes? Can you hear me? Can you talk? So there is no response to the patient. Do you have pain? Can you feel pain? So I will try to see if he has pain, if he do any response. Okay, so there is eye opening to the pain stimuli. And can you lift your arm? Can you lift your right arm? Can you lift your left arm? Can you lift your right leg? So there is no response. Now I am check to pinch him if he is responding or not. So there is no verbal response at all. Check the movement of extremities of pain stimuli. So there is movement on the extremities of pain stimuli. I will check the eye. After checking the eye pupil is dilated. The left eye pupil is dilated in 5 millimeter and on right it is 6 millimeter. I'm going to check the localized weakness. Localized weakness. There is weakness in the right side of the patient. Now I'm going to check if the patient have bleeding or any kind of trauma. There is no any bleeding or any kind of trauma in the head, no injury in the head. Then I'm going to palpate the head. After palpating, it seems that there is a occipital depression in the head, and in the behind the ear there is a bruising in the mastoid process. And and in the face there is autoneer renorear, and there is the bruising in the left side of the face on inspection, and the primary diagnosis is blunt hand trauma.
Hi, so our patient named Ali. So to confirm that you are the one of his relative, is that true?
Yes, I am.
Okay, so I'm going to ask you a few questions, and there are some questions that you need to answer yes or no. Is that okay?
Okay, sure.
Okay, thank you. So may I know how old is he?
He's 25 years old.
25 years old. Okay. What is his occupation?
Ali is a factory worker.
Okay. May I know where did he live?
He lives in Ulisa, Percussion.
Okay. So I'm going to ask you about his past health history. So is he experienced any gastric ulcer?
No.
No. Any allergy? Did he do any blood transfusion before?
No.
Okay. Is he smoke?
No, he doesn't smoke.
Okay. Did he consume any alcohol and drug abuse?
No.
Okay. Did his family has any health history?
No.
No. Okay, thank you. Did he has diabetes mellitus?
No.
Did he ever do any operations before?
No, he never.
Did he have tuberculosis? Stroke?
No.
Okay. Myocardial infarction? Did he has hypertension?
No, he doesn't have hypertension.
Did he consume any medicines?
No, as far as I know, he doesn't consume any.
Okay. Okay, that's all. Thank you so much. Do you have any question?
No, I don't have any question.
Okay.
From the subjective examination collected from the relative, we can conclude that the patient has no past health history, which may be affected when giving the treatment to him later.
Hi, today I will be doing the objective examination for the patient. So I will begin with general inspection on the patient. Okay, upon the general inspection, we notice that the patient has closed fracture on the base of the skull, and it's probably intracranial hematoma, and the patient has a rib fracture on the right side, probably the fourth rib of the patient, and the patient has closed fracture on the right ulna and radial bone, probably displacement, and the patient has closed fracture of the femur bone, maybe a dislocation too. Okay, now I'm going to do the general inspection for the respiratory system. Okay. So on the inspection, we can see that the patient has low and unequal expansion on the right side, and the chest wall looks abnormal with the wound on the right side on the fourth intercostal space. Now I'm going to do the palpation. Can you see 33? 33. 33. Okay, thank you. Okay. Do you feel pain? Yeah. Okay. So the patient has pain in the wound area, and there is air leaking through the wound. Crepitation and subcut emphysema is present. Ribs are painful, and the vocal fremptus is present. Okay. Now I'm going to do the auscultation. Okay, there is abnormality can be seen, and there's a dull sound on the right side of the fifth intercostal space, and the patient has respiration rate of 26. Okay, now I'm going to do the percussion on the patient. Sorry. Okay. During percussion, the sound is not normal, and there's absence of sound in the right side. So I conclude that the patient has pneumohemotor on the right side. Okay, now I'm going to inspect the cardiovascular system of the patient. Now I'm going to do the inspection. Okay, upon inspection, there's no any signs of pulsation is noticed. Now I'm going to do the palpation. Okay, upon palpation, I've noticed that the patient's heartbeat is very low. Mainly the apex beat is very weak. And now I'm going to percuss the patient. Okay, upon percussion, there is a dull sound over the heart region. Now I'm going to auscultate the heart region. During auscultation, the heartbeat was very low and murmur sound was present. Now I'm going to check the blood pressure of the patient.
May I check your pulse? Okay.
The patient is hypertensive with blood pressure of 90/50. The patient has weak pulse too. Now I'm going to inspect the GIT of the patient. So may I see your heart? Okay, thank you. So the patient's tongue is very dry and there is distended abdomen and he has mixed breathing. There's no scars and no medulla, and he has a bruise on the right hypochondrial region and distension, and there's no signs of hernias, scratches. Now I'm going to auscultate the patient. Upon auscultation, there was no any sound of peristalsis was not noticed. Now I'm going to do the palpation. So, tell me if you feel any pain. Can you cough? Okay, thank you. Do you feel pain during cough? Yes. Okay. So the patient has pain in the abdomen region and during cough everywhere in the abdomen, and only superficial palpation can be done because the patient feels pain. Okay. Upon the digital rectum examination, we observed that it is normal, and upon examining the GIT of the patient, we conclude that the patient has hemoperitoneum. For primary diagnosis, we see that the patient has closed fracture of the skull, intracranial hematoma, closed fracture of right ulnar and radial bone, and closed fracture of the femur bone. The patient also has rib fracture and pneumothorax. The patient also has hemoperitoneum. Before final diagnosis, we need to do additional investigation such as complete blood count, a blood test, ultrasound of the abdomen, X-ray of the right arm, X-ray of the chest. On the lab results, we see that the patient has low RBC and WBC count, and on the chest X-ray we can see that the patient has fracture on the fourth rib of the right side. Upon the X-ray of the right forearm, we can see that the patient has dislocation of radial and ulnar bone. On the ultrasound scan of the abdomen, we can see that the patient has hemoperitoneum.
The family of the patient, right, sir? So after all the tests that we have done to the patient, we have come to this final diagnosis, which is the patient has closed fracture of the skull base, and he also have intracranial hematoma on the right side. He also have closed fracture of the right radial bone with displacement and angulation. Also closed fracture of the femoral bone with displacement and shortening. He also have penetrating right side chest wound, rib fracture, right lung atelectasis due to pneumohemothorax, and then he also have blunt abdominal trauma and liver damage with hemoperic. And the complication of this, he will have internal bleeding, hemothorax, and also 30% blood loss. So the patient has to be admitted into surgical department, and he will be positioned in supine position, and he won't be having any physical activity, and his diet will be NPO diet, and also he won't be having any exercise, and he will be given medical therapy targeted at symptoms, and also he will be given infusion therapy to meet his vitals, and also he will be given non-steroidal anti-inflammatory drugs for his pain. I would like to tell you about the surgical treatment. He should be going through some surgery, which is surgery on the skull for trepanation to evacuate the intracranial hematoma, and also surgery on femoral and radial bone. This is for femoral to open reduction and stabilization of the bone, and then for radial bone, we will do close reduction and stabilization, and also he will go through chest draining on the right side, and also abdominal surgery to fix liver. Okay, so before I ask for consent for the surgeries, I would like to explain to you about the 5 different surgeries that the patient will go through. So this surgeries is indicated to the patient, and it is life-saving surgeries. So first we will do skull surgeries, which is to evacuate hematoma, and then we will do chest surgery, which we will do chest draining, and then we will do abdominal surgery, which we will do laparotomy and fix the bleeding. So the patient will be put under general anesthesia, and then for the risk of surgery is quite high, and then the risk for thromboembolic complication and also bleeding complication is high too. And without this surgery, chances to success is doubtful, but with surgery, chances to success is 70%. After that, we will do thigh surgery. This surgery is indicated to the patient and absolute surgery. We will do open reduction and stabilization of femoral bone. We will give local anesthesia to the patient. As for the risk of surgery, it is moderate, and the risk for thromboembolic and bleeding complication is also moderate. Without this surgery, the chances to success is doubtful, but with surgery, chances to success is 70%. So, sir, do you agree for the patient to go through all these surgeries?
Yes, I want the surgery.
After that, the relative of the patient is given the consent form to fill in and sign. So for pre-operative examination, the height of patient is 170 cm, the weight is 70 kg. The surgical site is at right temporal. The patient has history and physical examination report. and we will check the natural teeth of the patient present, and patient doesn't have any dentures at the upper, lower, partial and bridge, fixed or crown, and patient is not wearing any contact lenses or jewelry, and the blood available for this patient is A negative 500 ml, and also the vital signs are 120 for pulse, respiration is 26, blood pressure is 90/50. So the shaving area is already shaved, stomach is empty. For surgical operation report, neurosurgery, firstly we prep, drape and surgical access, and then we will do incision at the right temporal area, and we will open the skull with a saw, and then we will evacuate blood and ligate bleeding vessels, and then lastly we will close the wound. Okay, for surgical operation report on chest training, first we will do prep, drape and surgical access, and then we will do incision at anterior axillary line at 7 intercostal space, and then we will insert a tube with a clamp to evacuate air and blood, and then we will attach the tube to draining system, which is 2 bottle or suction, and then we will fix the tube. For surgical operation report on abdomen, first we will prep, drape, surgical access, and then we will do incision at midline abdomen, and then we will open the cavity. We will find the injured organ and then fix it, and then we will evacuate the blood, clean the cavity and insert abdominal drain, and then we will close the cavity. Okay, so for surgical operation report on thigh, we will first do the prep, drape, surgical access, and then we will do incision at thigh to reach the fractured bone, and then we will reduce bones, fix with screws, and then we will evacuate blood and clean and insert drain, and lastly we will close the wound. Surgical report for fixing fractured radius, we will first give anesthesia to the patient, and then we will do close reduction, which is by pulling in opposite directions and pressing on fragments, and then we will do x-ray to see if the radius is already okay, and then we will apply podcast or splint. During intraoperative monitoring at 1 p.m., the patient has pulse of 100, which is increased than the goal, and then the patient also have respiration rate of 22, which is also slightly increased from the goal, and the patient has blood pressure of 100, which is slightly decreased from the goal, and then the consciousness GCS is 14, and then we will continue to monitor the patient. We will re-examine him in 15 minutes. Okay, so for post-operative fluid chart, starting from 2 p.m. and 3 p.m., the patient is given 2,000 ml of normal saline, 1,500 ml of Ringer, 500 ml of RBCs, and 500 ml of FFP, each for 2 p.m. and 3 p.m. And then starting from 7 p.m. until 2 p.m. the next day, patient is given 100 ml of dextrose 5% water hourly, and then from 8 p.m. until 6 a.m. in the morning, patient is given 200 ml of Ringer. These fluids are given to the patient because for electrolytes balance and to increase red blood cells after losing during surgery. For post-operative, the vital signs of the patient seems in normal range. For pulse, it starts with 90 at 2 p.m. and then it decreased to 78 at 3 p.m. and then it stabilized at 78 until 6 in the morning. And then for respiration rate, it starts with 20 at 2 p.m. and then it decreased to 18 at 3 p.m. and then it stabilized with 18 until 6 in the morning. And then for blood pressure, it starts with 130 at 2 p.m. and then at 3 p.m. it increased a bit to 131, but then starting from 6 p.m. it decreased to 120 and it stabilized there until 6 in the morning. And then for consciousness level, it starts with 9 and then it slowly increased to 15 at 6 in the morning. And then for body temperature, it starts with 37 degrees and at 2 p.m. and then it increased to 38 degrees at 3 p.m., which indicates that the patient is having fever. And then the fever drops at 6 p.m. and then at 9 p.m. the body temperature of the patient starts with 36.9 and then it stabilized there until 6 in the morning, which indicates that the patient no longer have fever. So this vital signs shows that the patient is recovering well. For post-operative medication, the patient is given heparin to avoid blood clots at 2 p.m. and then patient is also given ibuprofen intravenously for the pain, to relieve pain for the patient at 2 p.m. and then patient is also given antibiotic cephalosporin first generation at 2 p.m. and then at 9 p.m. heparin and ibuprofen is also given to the patient, and also at 4 a.m. in the morning heparin and ibuprofen is given to the patient.